3-4 months.
4 months.
It depends how you prepare. You must have a strategy lah how you want to do it. Whether you want to learn the thing first and then you proceed with the discussions. It depends. Kalau you nak start maybe 1 month or 2 months or 6 months prior to the exams also boleh. It depends on how you do it lah. Question number 2, I think Dana got what are the resources you use to prepare?
We did a timetable lah. So basically we took all the past years, then combined it with the main book, and so what I did was I did a timetable. Then we practice among the 3 of us about 3 to 4 times per week through Zoom now. So we did about 2 to 3 stations per session per person. And then towards the end, it was like 7 stations per person. So that's what we did. So we studied based on that. We didn't go into any course, but I think in terms of courses, Shankar studied like one right. We went to the
last minute for the exam, just went for the
Which course?
not a course, it's just like some Kazi guy.
the Kazi. You know, there's a honey.
Dr. Hani,
yeah. So honey was a bit too expensive for us lah, because we were quite short of cash. So yeah. So unless you guys want one person go, then the other one person then you guys share and he develops the info and can so. But Shankar did the last minute with Kazi. Kazi basically did one session. But the downside of one session is also because you can't really practice your research and stuff because it's Zoom as well. But I think especially for the one foreigners, they said it really helps out the cost. We're not too sure about that.
And then the other thing is if you can subscribe Roomly emergency courses per month around berapa?
$100 bucks.
90 ringgit.
90 ringgit.
90 ringgit from your
I think it's for examinations, Wikimedics is better. For communications, I think Roomly is better. And also how they do a resuscitation, also Roomly is better. The history, they did not much in Roomly, more on communications. It's very good, for example, how you want to tackle the NII, the angry patients, all's there. So you just take and have a look. Yeah, sorry?
The Bromley.
Roomly you have to subscribe.
Gomni is a 90 videos one, right? That one I think we have a folder, the Gomni videos. Is it the same? I don't know whether is it the same or not.
Dia ada yang version lama, ada yang version baru.
So that one quite lama lah, I think 2011.
So kalau dekat apps pun actually ada Roomly kalau you type.
Because there's one MRCEM group in Malaysia, they have a folder, then there's 90 videos there, so the Gomni one.
Oh, then maybe.
But not sure whether it's that one. Not sure whether it's the same or not.
Maybe check and see. Number 3, Shankar Cancer. How do you find the OSCE exam then?
Talk about the weather. It was nice. Warm on certain days. Place is quite accessible by tube. So I think getting there is no problem. Examiners, they don't talk to you. No
They just don't
communication.
communicate with you at all.
Oh,
Everybody around them, the helpers are very
But
supportive.
the
You see, you can do it. The rest station, they'll be giving you motivation.
Yeah.
They will give you some motivation, coffee, water, all you have. Simulated patients are actually very, very good. I've never come across such a realistic patient in my life.
what do you mean by that?
I mean, really realistic. As in, when you go to that station and you see that this is a depressed patient, believe me, you will think she's depressed. She really thinks she's depressed. And she's going to fight with you, she's really going to fight with you.
Yeah.
There's no laughing all in between. Really serious lah.
But it's a simulated one, it's not a real
Yeah,
patient.
it's simulated, but it's real lah. They really do it well lah. They're there to help you. The patient will help you. If you have certain things, if you forget to ask, doctor, I want to ask about this, something about that. So they're quite helpful, I would say. Patients are good. Examiner don't look at you. You don't look at them. Finish examiner, just don't go look at them. There must no interaction with examiner unless there's a part that says that you need to present to the examiner your findings. Yeah, other than that, zero interaction. They may prompt you once in a while. If you're slightly off track, they'll say, please read the question again. That's all. Other than that, nothing much on their side. I guess preparing is one thing, but it's different when you go there. Really different, I guess. You prepare, so you seem to do the thing very well, but and their communication is not easy, I would say. Not like something very easy, or you fight here, you fight there and finish. Then you can really drag and go to another world and come back. You must be a bit careful and alert, so they really can. Questions they ask you you never think about it also.
I think the procedures, it's memang if you cover all the procedures by right, you feel that it should be okay, but focus also on your post-procedural advice lah, because that's basically they're going to ask you after that.
Alright, next, what are the most challenging stations you have encountered? For me, I encountered communication station is quite challenging. For me, I did NAI cases, and the other thing is DNR station. For example, for in DNR, okay, the communication in MRCEM OSCE is a bit challenging. As I said, 1 minute you read the questions outside. The next thing, when the bell rang, you go inside, they give you another 2 pages of info. So you need to read, speed reading. All the info is like, what's the airway, patient's upper breathing, see, a bit detailed, and a lot of patients punya detail as well. For example, patient is nursing home for 1 year, moribund, came with pneumonia, and then 89 years old, so the family is there, and then the specialists that come medical ICU not taking the patient, so you have to explain to the family about the DNR, and then the relative, the actress is actually mentioning about can we challenge that, meaning they want to challenge the DNR. So in this situation, you maybe can inform them how about the patient's condition. And then later on, yes, if patients have angry, for example, have to remain calm and be professional. They basically just want to test your communication, not much on knowledge, I think. So there are certain points, and then sebelum masuk tu dia ada pie chart. So pie chart tu you can tengok betul-betul. For example, if communication, conflict resolution, and itu dia ada 3, conflict resolution dengan data knowledge sikit lah. So kalau you tengok dekat pie chart tu, kalau for example di conflict resolution tu lebih, so you kena a lot of communication dengan patient, how you want to tackle it lah.
They will show you before you start.
Sorry?
They will show you the pie chart before you start.
Before you go in, so 1 minute tu dia akan bagi questions and then bagi pie chart. So bila you masuk, you dapat extra info about the patient that you want to this one, and then so kena speed reading, duduk situ, and then start lah. I think for me it's communication lah. Examination I don't have too much. Maybe Shankar want to share? Challenging session? No, anything.
Challenging.
I think I agree. Communication was not easy. Sometimes the resuscitation station can be a bit confusing as well. And it seems that even though you do an intervention, like someone came with a contraction rate of 5, you put an immediate intervention, you give an LMA, you're bagging it every 6 seconds, they have good chest rise, still the examiner says RR is 5. So it can get a bit confusing. So sometimes the resuscitation not like our ACLS now.
It's not as what the result is not as what you're expecting.
Yeah. A bit weird. You know, the scenario is nothing much, and suddenly the
Bit of a letdown for the result.
yeah.
For me lah.
Suddenly they just 75 years old, shortness of breath, brought into your ambulance, brought in. And then suddenly you have come out with a diagnosis of pneumonia.
Yeah, it makes
It's
sense.
just a bit weird lah. And then before you can do anything, I want to take it's okay. Oh, the toughness already did everything. So you're like, they are going far ahead. Before you can put stethoscope, can get a bit kelam kabut because they are going so fast and you're not following your also.
Oh, I thought they would want you to perform, to check.
No, before you they already because they want to finish the session fast because usually cannot finish in 7 minutes. So they everything. So usually then next day you
So if they already intervene, what is our role in that station?
You have to follow the ABC lah.
You have to mention and get the points, is it? That's what you're saying.
For example, research, you read the questions, you go in, they give you about 1 minute, you have to introduce yourself, get to know who are your assistants, whether they are ATLS trained or APLS trained. Then after that, once you settle everything, want to prepare everything, delegate the roles, then patients come. So patients already there lah, so you just pakai kain and the child is there. And then you start lah from A, but most of the time you are the team leader. So kalau for example, for example, if you want to do
I mean the performance that you won't do, you just instruct.
yes, just instruct. For example, if you want to
Macam
do
kita punya CLS, macam you ask Khatib, you ask Khatib. Tapi
Yeah.
when yang buat intervention, you ask someone else to do intervention. Macam MCLS gitu. Sama. It's the same.
So for example like circulation, the person in charge circulation you ask them what's the PPA
Just put the BP car. Macam dalam MCLS, they ask for BP car.
you put or they
They put.
They put.
Intervention dia put. Tapi macam examination.
So you never
lah.
touch the patient.
You pulse volume semua you touch lah. Pulse volume, CRT.
So
It's exactly like our
not like our molage per se.
It's exactly like our molage.
actually is
No, I
like our molage.
It's exactly like our molage.
Like our molage.
Yeah. Barat dia dulu. Not in red zone itself, it's when we do the research.
But the thing is, UK kalau intubation usually they will
Ask
you have to call for
intensive.
help from NS. You need to call the NS early lah. Kalau NS sampai then intubate okay lah. Kalau if not, you just begging and do whatever necessary intervention.
don't intubate lah. Usually we go until LMA, is it?
Yep, up to LMA. It depends. Kalau for example the examiner say, okay, you got the NS ataupun you get the airway trolley ready for intubation, then maybe you can proceed with intubation. But most of the time, you not gonna intubate lah.
So meaning you get a case, memang you think you only need an intensivist, you have to mention it before.
Yes.
They won't intervene.
Yes.
Understand.
Just need to call the ICU or need to call the anesthetist lah.
You can't intubate.
How's the food?
Sorry?
How's the food? Suck.
Really
The
good.
food, the food.
Food, correct?
Is it like expensive? Like, or do you cook yourself?
How much you guys pay the whole to get into the exam level? 2 weeks.
Accommodation is around 9,000 ringgit Malaysia. But share 3 of us.
9,000.
Travel, maybe airplane dalam 3,006. Aku lagi train dekat sana. So train dekat sana maybe around 50 pound using Oyster card. The food I think it's quite okay. Kalau nice meals around
20 pounds.
less than 20 pounds per meal.
That is
Kalau yang kurasi fast food maybe 10 pounds.
Staying there lah.
Yeah. I think it's quite good. Good
Working there,
experience.
I think it's cheap lah. You're staying there, working there, it's cheap actually. The tax and shit. Can't have it all lah. Can't have it all. The tax is
Right, last question. What is your advice for future OSCE takers? You have to formulate what strategy you want to go, how you want to practice, and then number 2, make sure you have friends or gang to practice. Just practice until you formula with the station lah. For example, macam ada certain station, for example macam Thomas Plin, kita nak biasa buat kat sini, so you have to know kita nak biasa dari diri lah. practice is one thing. When you go to the exam, you have to read the scenario, what they ask you. For example, at that time, I got a depression. At the same time, you want to assess the mental capacity as well. The two in one station. So you have to read properly lah. Any advice?
Any advice?
Just I think the practice together, then your examination part I think we do it all the time. Just that it's going back to my first student lah, look at the hands, chest, the inspection publication unit. That one you have to practice to do it within the 7 minutes, so that's within your practicing lah. 7 minutes is very important. You have to give some time for the last minute questions so that the patient might have for you. So you should end at least time yourself to end by 5 minutes and a half, 6 minutes max lah. Communication you can prepare, but a bit hard lah. For me, the communication is quite hard to prepare. Maybe just know the guidelines, the legal laws, especially the one in UK. Then familiarize yourself with that, then should be fine. Yep.
Any advice? I think that's all. Any questions?
Where do you go, like, how you want to familiarize with their system or their terms and everything? Where do you go and look for that source?
Either you go to the RCAM learning website, or you just go to the website, NCT website lah. For example, DVLA, patient having seizure, they cannot drive, so there are certain things, for example, the car, motorbike, they free maybe 6 months they nak drive, or 1 year with epileptic. Truck driver tak boleh drive for 5 years, 10 years.
It's all in the website.
In the website.
It's all
in the
just
website.
like
That's it je.
DBLA, UK,
Yeah.
it's all there. So most of it is most of it is online. So don't worry about that. It's all online. And then your green book also will roughly summarize the guidelines, the adherence of monitoring guidelines. So it should be.
Thank you.
Yeah.
I think that's it.